right, so here we have a 54-year-old man who comes to the clinic because of progressive difficulty walking for the past 4 months. He reports numbness and tingling in both feet, which gradually ascend to his mid-calves. He also says he cannot feel the ground well when walking. His diet consists mainly of tea and bread. He has a history of chronic gastritis and takes omeprazole daily. Neurologic examination shows decreased vibratory sensation and proprioception in both lower extremities. Muscle strength is 5/5 throughout. Rumbuck test is positive. Reflexes are 3+ in the knees. There's mild spasticity in the lower limbs. Which of the following is the most likely cause of the patient's neurological condition? Okay, now if you just look at the vignette, there are a few pointers here, right? So he has paresthesias, so numbness and tingling in both feet. Okay, you cannot feel the ground well. Yeah, that's there. His diet is mainly tea and bread. He has a history of chronic gastritis. He has decreased vibratory and proprioception sensation. Rumbuck test is positive, and he has spasticity. Okay, so what are we looking at here? If you just focus on the decrease in vibratory sensation and proprioception, this starts leading you in the right direction, right? So the dorsal columns are affected, okay? But there are a bunch of things that have the dorsal column affected. If you then add the paresthesias, you add the diet, right? So you can't really get a lot of nutrition from tea and bread. So if you add that, you're now heading in the right direction as well. The Rumbuck sign just tells you that there's something wrong with the dorsal columns, right? So here we're looking at B12 deficiency, right? So B12 deficiency, and if it's severe enough to cause neurological symptoms, we're looking at subacute combined degeneration. So subacute combined degeneration, right? So the answer for this is A. Okay, so if you just think about it, what pathways or tracts are affected when you have subacute combined degeneration, right? So just pick the first letters of each of the words in subacute combined degeneration, and you kind of know where you're headed there. So in the subacute, just go with spinocerebellar. So spinocerebellar tract. For the C, you can go with the lateral corticospinal, so cortical spinal. And then for the D, go with the dorsal columns, so dorsal columns. So that's an easy way to remember the tracts that are affected here, right? So if you have dorsal columns affected, you're going to have decrease in proprioception and vibratory sensation, okay? And then if you have the corticospinal, again, what happens when you affect the corticospinal tract to all the other levels below, usually where you have the lesion, right? You're going to get upper motor neuron symptoms, right? So that's where you get the spasticity from. That's where you get the hyperreflexia from, right? So 3+ is hyperreflexia. So from the corticospinal tract being affected, you're going to end up with your spasticity. Dorsal columns being affected, you've got the vibration and proprioception, right? So the Rumbuck test, by the way, just so you know what it is, if you're quote unquote normal and you're standing and you're asked to close your eyes, right, you should still be able to stay standing straight without swaying, right? Because you can feel the position of your body parts, right? So your proprioception, okay? Now, if you have a problem with your dorsal column, if you were to stand and open your eyes, your vision will sort of help you adjust and keep you standing straight. But if you close your eyes without the visual information coming in, you're relying on proprioception, which is now messed up. So with that, you end up swaying, right? So that's all the Rumbuck test is. So Rumbuck test positive in this patient. Okay. If you look at the other options, mutation in the frataxin gene, so that's talking about Friedreich's ataxia, right? So if you have a mutation in frataxin, that's Friedreich's ataxia. So Friedreich ataxia, right? So you do have an ataxic gait. You might have problem with vibration sensation. You will also have pes cavus, so that's the high arc of the foot, right? And you might also see in the patient hypertrophic cardiomyopathy, and this usually starts in adolescence, and we're talking about a 54-year-old man here, right? So that's out. Then we have the defective aerosulfatase A enzyme. Okay, I hate all lysosomal storage disorders, and this is one of them. This is the metachromatic leukodystrophy, right? It usually starts in early childhood as well, and you will see like progressive cognitive and motor decline in the patients, as well as peripheral neuropathy. Okay, then there will be vitamin E deficiency due to fat malabsorption, and yes, it is going to be due to fat malabsorption because you remember the fat soluble vitamins A, D, E, K, right? So that's what you're going to see there. You might see some hemolytic anemia in a patient with vitamin E deficiency, and reflexes will be reduced. So there's hyporeflexia as opposed to hyperreflexia in this patient. Okay, E, copper accumulation in central nervous system. So this is referring to Wilson's disease. So Wilson's disease. And if you remember, this is the one that you have the Kaiser-Fleischer rings if on eye exam, right? If you look at that, it's the one that affects the basal ganglia as well. So you're going to have some movement disorders going on. All right, thank you.